Good morning, Hong Kong, and welcome back to another episode of Hong Kong Insurance 101. This week, we're going to start with a question. Can you rely on Hong Kong's public healthcare system? Now, CCW Global has always championed the availability of Hong Kong's government-run healthcare services. Provided at extremely low costs, Hong Kong's public healthcare system is able to offer a very high level of care, which in turn sees private medical insurance become a luxury product to local residents. Why spend thousands of dollars each year on a health insurance policy when you can receive the same services at a public hospital or clinic virtually free of charge? At CCW Global, we have always stated that private health insurance is not a necessity for Hong Kong residents. While there are benefits to having medical cover or using private healthcare services, the standard of care on offer is no different to that being offered by the Hong Kong Hospital Authority. But there are some concerns. In the last 2 years, a string of medical blunders have seriously eroded the confidence we once had in the public healthcare system. From nurses forgetting medication leading to patients dying, unsupervised procedures being performed by trainees, to the removal of a patient's reproductive organs without their consent, cracks are starting to appear within the hospital authority. It should be noted that in 2018, well before the emergence of the COVID-19 coronavirus, there were serious concerns about a manpower shortage within the public healthcare system. A staff turnover rate of 5.7%, with a 10% turnover rate of doctors in more specialized fields, means that doctors and nurses are under severe amount of stress due to their workload before Hong Kong started to experience the additional pressure of the pandemic situation. This manpower issue has a direct impact on the services which hospitals and clinics are able to offer. Fewer workers will inevitably mean less space for care. In fact, floor space at many hospitals is vastly underused, and fewer beds are being offered to inpatients as a consequence. This in turn leads to fewer people being treated at any given time, lengthening the overall waiting period for care, creating more demand and more stress on the public healthcare system as a whole. Then we ran into the COVID-19 coronavirus. The unique pandemic situation caused by the COVID-19 coronavirus and the extreme isolation and quarantine measures needed to effectively combat the disease while treating patients has only highlighted the shortfalls within the public healthcare system. With only so many doctors and nurses, and the fact that hospitals are able to cope with fewer patients than they should, compromises are being made around the pandemic that are leading to, quite frankly, deadly outcomes. In the first 10 months of 2020, Hong Kong saw 136 infections of the deadly fungus Candida auris, compared to 20 cases during the entirety of 2019. Candida auris is a multi-drug resistant fungus that has a mortality rate of between 30 to 60% in people infected, according to the CDC. As of October 24th, 2020, there were 1,394 cases of Candida auris globally. So it is concerning that Hong Kong has experienced a tenth of that number in cases this year. Further concern should be realized with regards to the many unknowns from this fungus and the fact that it is able to spread through environmental contact, contamination of equipment and surfaces, and person to person. Although the fungus has mainly affected people aged 60 or over, it has been found to infect individuals as young as 20. While the standard course of action for a Candida auris outbreak is to separate and isolate the infected person, due to the COVID-19 pandemic, this has proven to be increasingly difficult. As COVID patients need to be quarantined in order to stop the spread of the disease, isolation units at public hospitals have reached capacity. This has forced medical providers to place individuals infected with Candida auris in ward settings, increasing the potential spread of the fungus. Wards are not hermetically sealed isolation units, no matter what stopgap measures are created. Hong Kong's private medical system is responsible for roughly 10% of the treatment burden while having around 60% of the city's doctors. Obviously, there is far more capacity in the private healthcare system, and with the standard of care being roughly equivalent, the primary reason for opting to use private medical care in Hong Kong is ease of access and speed of treatment. There is, however, the issue of cost. The major reason that Hong Kong's private healthcare system only shoulders 10% of the overall treatment burden is the fact that it is extremely expensive. In fact, Hong Kong is second only to the United States of America in terms of how much it costs to receive treatment when it comes to private care. This means that for many people, treatment at a private hospital or clinic is not realistic. It simply costs too much, unless, that is, they have private health insurance. Now, health insurance does come with a premium cost, although this is far lower than the cost of treatment for an inpatient condition at a hospital. Plan premiums are generally rated based on your age and your geographical coverage area. So policies are usually cheaper for younger people with a more focused area of coverage. Despite this, the Hong Kong public healthcare system is not in as good a place as it was 5 or 6 years ago. And the cost of private health insurance may actually be a very good investment in light of the worrying conditions and suspect outcomes being produced by the government-run system. Global can help you make sense of your healthcare and health insurance options with our guarantee that you will not be pressured to buy anything. Contact us today for a free, no-risk, no-obligation consultation with one of our expert health insurance brokers, and let us help you. That's us for this week. As always, we hope you have a happy and healthy weekend. Please remember to like and subscribe to all our content as it comes out, and don't forget to ask CCW. We're simplifying your insurance.